Joining us now, we have Courtney Roberts from Eli Lilly. She is here to talk about a new initiative to help the dire situation in India. Welcome.
Hey, Mary. Great. Thanks for having me. Great to be here.
Well, okay, so I understand Lilly is planning to donate therapeutics to India through this organization called Direct Relief. So first, can you tell me what made you want to do this? And then what is specifically Direct Relief?
Yep. So as this pandemic has continued to evolve over the last year, our intent has been to help as many people as possible, particularly in low and lower middle income countries. And so we announced just this week that we will donate our COVID-19 therapies to Direct Relief, who will provide these therapies at no cost to these countries hardest hit by the pandemic. This provides countries with options for treating patients at different stages of the disease, from mild to moderate patients at risk of hospitalization to those actually requiring supplemental oxygen.
And what, so right, you have this initiative, low and lower middle income countries. It's been something, a part of your work since the beginning of the pandemic. And what was your decision to work with Direct Relief for this effort?
Direct Relief is a long-standing partner of ours who we work with on several fronts, actually, from disaster relief in the US and around the world to donating and distributing insulin to low-income countries through Life for a Child. Actually, also to a recent donation of COVID-19 antibodies to Morocco and Rwanda. So we've worked with them for a long time. They are long-standing, trusted partners. And as a part of this most recent announcement, governments will work directly with Direct Relief to assess need and allocation in country. And allocation will be based on disease burden and hospitalization rates in each country.
Okay, right. So you have sort of that priority list of first. But so this is not a new relationship. This is something, as you just mentioned, from what I understand, what you just said, you worked with insulin, distributing insulin to lower socioeconomic countries, as well as plasma donations or antibody donations.
Yes, we've worked with them on our most recent COVID-19 therapeutic donation of COVID antibodies, and then also with Life for a Child, we donate insulin to Direct Relief. Direct Relief then works with Life for a Child to distribute insulin to low-income countries for children with type 1 diabetes around the world.
Wow. And is there any reason why this specific drug? I mean, I've read the reports that it reduces hospitalization, it reduces for severe COVID, very promising things, but why specifically this and not something like antibodies or something?
So in donating both this and antibodies, we're actually giving countries an array of options for what they can use to treat COVID-19.
So specifically, India will get not only this drug, but they'll also get antibodies, or am I misunderstanding?
No, you're right. As the crisis has grown in India, we knew we wanted to help, and we knew we could help. And so we are working with the Indian government to immediately make available a donation of 400,000 baricitinib tablets, making that available to the Indian government. We're also working urgently to increase that amount over the coming weeks.
Oh, okay. So this is just the beginning for
yes.
Tablet. So there's plans for the future to do more.
Yes, and actually, in addition to the donation of baricitinib, we're also working with local pharmaceutical companies within India to accelerate manufacturing and distribution within the country so people can be treated as quickly as possible.
Right. I know distribution has been an issue, here in the U.S., and I can't imagine what's going on. Well, just based on the reports that it's chaotic and difficult over there. So that's interesting that you guys are also helping with distribution, right? Because you can send it over there, but then if you have no sort of organizational type of way of distributing, then that's a problem, and it might not reach the people that it so desperately needs to reach. So wow, that's incredible. Also around the world, you guys are also helping to combat this pandemic. So can you speak to these other efforts?
Yes, so Lilly is bringing the full force of our expertise to attack this pandemic, from setting up drive-through testing very early on in the city of Indianapolis at our corporate headquarters, to cash contributions to organizations like the Red Cross and the Central Indiana COVID-19 Relief Fund, now to our second major donation of Lilly Therapeutics to address COVID-19. We've also engaged our employees in this effort. Thousands of employees around the world have volunteered, including at our local testing site in Indianapolis. Lilly employees and the Lilly Foundation have given more than $2.5 million in donations in response to COVID. And we've also donated PPE around the world. So we have really galvanized all parts of our companies to tackle this.
Wow. I don't know about others, can't speak for others, but you guys make me proud to be a Hoosier. So grateful you guys are based in Indianapolis. All right, any last thoughts on or final thoughts moving forward in this effort specific to India?
Specific to India, this is the beginning. And like I said, we are donating product. We are also working to increase manufacturing capacity locally on the ground. So this is not just a donation of product, it's really actually also increasing infrastructure and capacity on the ground in India.
Wow, well, that's incredible. Thank you so much, Courtney, really, for all that you guys do over there and for your work.
Yeah, great. Thank you so much. And I would just like to leave with, we have a long history of helping communities around the world, whether it's through our historical work to address multi-drug resistant tuberculosis, to strengthening health systems in Kenya through our partners at AMPATH, to our partnership with Life for a Child, providing insulin to children around the world with type 1 diabetes. And now our efforts to address COVID, ensuring that all people around the world have access to those therapies. And this is what we do and what we'll continue to do. And this is all tied to Lilly's purpose to make life better for people around the world.
Well, sounds like it's been a company mission from the very beginning.
Great. Thank you.
Thank you.